Hello, and welcome to module on population health and health systems response to COVID-19. I'm Josip. I'm a GP, Director of Center for Population Health Sciences, as well as of WHO Collaborating Center for Digital Health and Health Education. And in this module, as the title says, we'll cover population health and health systems responses to pandemic of COVID-19. What will we cover in this module? As I prepared the slides, I wrote as my notes that they will be outdated as you watch this video. In fact, as we are recording this video, this information is already outdated. So first thing to say, we are already in pandemic, not epidemic. Second thing to say, this presentation is trying to give you a view of some of the most salient points, but the response to this pandemic is so massive and unprecedented that we cannot possibly cover all aspects of this, because literally on a daily and hourly basis, interventions are changing, as well as how countries and whole continents are dealing with this pandemic. Let's quickly look at what are the key aspects that we will cover. So from the comparison of COVID-19 to previous global outbreaks, our current response, possible scenarios, key factors that influence the pandemic, and strategies that are being taken. We have every day new insights into COVID-19. The data prepared on this slide will be outdated as you will watch this presentation, and importantly, we are now at a stage of pandemic. As you see, the number of cases in Singapore has more than tripled, and now hundreds of countries are in an unprecedented response to the pandemic. Epidemiological characteristics of COVID-19. A summary of a report from the Chinese CDC has been published in JAMA, showing the largest case series to date of coronavirus cases. The report includes a total of 72,000 case records, of which some 44,000 were classified as confirmed cases of COVID-19, with the diagnosis based on positive viral nucleic acid test result. And 81% of cases were classified as mild, i.e. with no pneumonia or mild pneumonia. However, 14% were severe and had dyspnea, respiratory frequency of above 30 a minute, blood oxygen saturation below 93%, etc. And 5% were critical. They had respiratory failure, septic shock, and or multi-organ dysfunction or failure. No deaths occurred in the group aged 9 years and younger, but cases in those aged 70 to 79 had 8% case fatality rate, and cases in those aged 80 years and older had nearly 15% fatality rate. The case fatality rate was 49% among critical cases and was elevated among those with pre-existing comorbidities such as cardiovascular disease, diabetes, chronic respiratory disease, hypertension, and cancer. Current mortality rate of clinically manifested COVID-19 is around 3.4%. And as we speak, globally, this is changing, and some major differences are displaying between the countries. By comparison, the 2002 SARS outbreak had a mortality rate of 10%, and despite having fewer than 1,000 cases worldwide, the 2003 avian flu H5N1 outbreak caused nearly 500 deaths, a mortality rate of 52.8%. For further comparison, current US flu season, which has topped 30 million confirmed cases so far, has a mortality rate of around 0.1%. Before it was eradicated, smallpox had a mortality rate of 30% or higher. Despite all of that, Because of its high transmission rate, COVID-19 has now resulted in more total deaths than MERS, SARS, and Ebola epidemics combined. This slide shows the timeline of COVID-19 outbreak in China and Singapore and the response to the outbreak. And as you see at the end, on 11th of March, the World Health Organization declared the COVID-19 a pandemic. In this slide, we see 3 stages of evolution of today's pandemic of COVID-19. In stage 1, the transmission was limited beyond mainland China. In stage 2, we had sustained transmission demonstrated in subset of countries. And today we are in stage 3, where we have global pandemic with sustained transmission across most countries and all individuals and large populations at risk. We also see an unprecedented response of countries and whole continents to this pandemic situation. This slide shows key factors that will influence the impact of COVID-19 and differentiating factors relative to the SARS epidemic in 2009-3. We see in summary that there are clinical effects and socioeconomic response which differ significantly. Red dots are exacerbating factors and green are mitigating factors. Let's just look at a couple. So in the first part on the clinical effects, we see that the healthcare system significantly improved in China since SARS. On the other hand, we see in terms of the response and socioeconomic effects that medical supplies, beds, facilities are in short supply, not just first in China, but across all countries today. This slide is about the key factors that could influence the severity of the outbreak. Statistical modeling suggests that highly effective contact tracing and case isolation can control a new outbreak of COVID-19 within 3 months. The study implemented a branching process model in which the number of potential secondary cases produced by each individual is drawn from a negative binomial distribution with a mean equal to the reproduction number and heterogeneity in the number of new infections produced by each individual. Each potential new infection was assigned a time of infection drawn from the serial interval distribution. Secondary cases were only created if the person with infection had not been isolated by the time of infection. As an example here, a person infected with the virus could potentially produce 3 secondary infections, because 3 is drawn from the negative binomial distribution, but only 2 transmissions might occur before the case is isolated. Thus, in the model, a reduced delay from onset to isolation would reduce the average number of secondary cases. For both graphs, the x-axis represents percentage of contacts traced. To achieve control of 90% of outbreaks, 80% of contacts needed to be traced and isolated for scenarios with a reproduction number of 2.5. The probability of control was higher at all levels of contact tracing when the reproduction number was 1.5 and fell rapidly for a reproduction number of 3.5. At a reproduction number of 1.5, the effect of isolation was coupled with a chance of stochastic extinction resulting from overdispersion, which is why some outbreaks were controlled even at 0% contacts traced. As you can see on the second graph, isolation and contact tracing decreased transmission as shown by a decrease in the effective reproduction number. When the basic reproduction number was 1.5, the median estimate rapidly fell below 1. Which indicated that control was probable. For the higher transmission scenarios, a higher level of contact tracing was needed to be brought the median effective reproduction number below 1. The effect of isolation without contact tracing can be seen as 0%, where the effective reproduction number was lower than the simulated basic reproduction number because of rapid isolation of cases. And as you see, and as mentioned before, this is a historical representation. The number of cases in all countries on this slide has now dramatically increased and is representing a new phase of the pandemic. When the SARS outbreak hit in 2003, the concept of portable, handheld, perennially connected computers, aka smartphones, didn't exist in public imagination. Back then, the flow of information was much more straightforward, taking place through traditional media channels like print, radio, and television, and to some extent, internet. Fast forward today, it's not only that the world is facing the epidemic and pandemic, but is also infodemic, fueled by the rise of the social media. Fake news and rumors regarding COVID-19 are now far more publicly accessible and exacerbating the challenges faced by the public health officials. Thus, it is important to stress how communication strategies of all countries are an important part of the fight of this pandemic, and in recognition to this, all the social media or main social media have agreed to collaborate with the World Health Organization as well as ministries of health to promote the official sources of information. Let's now very briefly look at how digital technologies could assist. First, it can aid in diagnosis with an AI intelligent evaluation system of chest CT scan for COVID-19. Secondly, by tracking the spread of the virus and looking at future implications the virus could have on the economy. Thirdly, dealing with quarantine, using robots and video consults to support patients in quarantine. Assessing risk of case importation, checking for contamination. At the beginning of the week at which this was recorded, there was an app released in China which promoted monitoring of the citizens in relation to their movement. Next, tracking the spread. A team from Johns Hopkins Center for System Science and Engineering released a new live dashboard that integrates information from WHO, CDC to track the virus in real time. According to coronavirus action plans published by Department of Health and Social Care in the UK, public can play a role in supporting this response. Since this, all countries or majority of the countries have powerful strategies for containing the spread of the pandemic. The number of measures is likely to grow further, and you will be all not just hearing about them, but experiencing them in your own life. It is understandable to be worried about contracting COVID-19 and for fears to get heightened by the flow of negative news, especially increasing number of cases and deaths worldwide. Many countries have established procedures for psychological crisis interventions to deal with public health emergencies. In Singapore, Feiyu Community Services extended their online counseling portal for this purpose, while Silver Ribbon in Singapore started providing online emotional support from end of February. In summary, the virus is highly transmissible. Both observed experience and emerging scientific evidence shows that virus causing COVID-19 is easily transmitted from person to person. And the estimated reproduction number, that is the number of additional cases that are likely to result from an initial case without mitigation measures, is between 2 and 3. This is significantly more than it is for seasonal flu, which has that number estimated to be at 1.4. We have now an unprecedented response over 100 countries which are affected by COVID-19 with hundreds of thousands of cases. And this is affecting healthcare facilities which are being put under enormous pressure with this growing outbreak. In summary, once again, you are living through something unprecedented for humanity. And I'm sure you are learning as much as in medical school through the media, as well as through your own and your family's experiences of response to this pandemic.